Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Health problems in pregnancy. Introduction. Every pregnancy has some risks. Health problems in pregnancy can involve the mother's health, the baby's health, or both. The causes can be health problems you already have or health problems you develop during pregnancy. Sometimes it is hard to know what is normal and what is cause for concern. Always contact your healthcare provider if you are worried. Keep in mind that whether a complication is common or rare, there are ways to manage problems that come up during pregnancy. This program will help you understand health problems in pregnancy. It includes health problems before pregnancy and pregnancy-related problems, as well as a special section on infections during pregnancy. Risk factors, when to seek medical advice, and prenatal care are also covered. Pregnancy. This section reviews common terms and concepts related to pregnancy and labor. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. They include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. When a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The lowest part of the uterus is called the cervix. It opens into the vagina. During pregnancy, the baby is in a special fluid called amniotic fluid. The baby and amniotic fluid are in a bag called the amniotic sac inside the uterus. The baby gets nutrition from the placenta. The placenta is an organ between the amniotic sac and the uterus that grows with the baby during pregnancy. The mother's blood delivers oxygen and nutrients to the baby's blood through the placenta. The mother's blood also removes waste from the baby's blood through the placenta. The baby's blood travels to the placenta through the umbilical cord. The mother's blood does not go into the baby's body. When it is almost time for the baby to come out, its head drops down into the mother's pelvis. This causes the mother's belly to look slightly smaller. This is called lightening. Labor starts when the mother feels cramps in her abdomen. The cramps are the uterus muscles tightening or contracting. Health problems before pregnancy. Some women have health problems before they become pregnant that can lead to complications during pregnancy. To prevent complications, talk to your healthcare provider before becoming pregnant. Your healthcare provider may want to change the way your health problem is managed during pregnancy. Some medicines could be harmful if taken during pregnancy. At the same time, stopping medicines that you need could be harmful. Thankfully, if your health problems are well controlled, you are likely to have a healthy baby. This section discusses common health problems that can complicate a pregnancy. Some previous health problems that may affect a pregnancy include asthma, which may raise the risk for premature birth, low birth weight, and C-section delivery. Depression, which may increase the risk of postpartum depression. Diabetes, eating disorders, epilepsy. High blood pressure also puts a pregnant woman and her baby at risk for problems. Women with high blood pressure have a higher risk of preeclampsia and placental abruption. The likelihood of premature birth and low birth weight is also higher. Other health problems that may cause complications during pregnancy include HIV, being overweight, thyroid disease, uterine fibroids, which may cause premature birth or breech birth. Other health problems can also affect pregnancy. Talk to your healthcare provider before becoming pregnant if you have an autoimmune disease such as lupus, cancer, heart disease, kidney problems, In some cases, such as cancer, your healthcare provider may suggest you wait to become pregnant. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Pregnancy-related problems. Sometimes health problems can arise during pregnancy, even in healthy women. Some tests done during pregnancy can help prevent these problems or find them early. If a problem is found, follow your healthcare provider's advice about treatment. This can increase your chances of having a safe delivery and a healthy baby. Anemia is when you have a lower than normal number of healthy red blood cells. Anemia during pregnancy can cause you to feel tired or faint. It can also cause paleness and shortness of breath. It is often easily treated with iron or folic acid supplements. An ectopic pregnancy is when a fertilized egg implants outside of the uterus, usually in a fallopian tube. Symptoms include abdominal or shoulder pain, vaginal bleeding, and feeling faint or dizzy. Drugs or surgery may be used to end the pregnancy so your organs are not damaged. Fetal problems can arise during a pregnancy, such as poor growth or heart problems. If your baby is moving less than normal or is smaller than normal, some tests may be done to determine if there is a problem. The mother may need special care throughout the pregnancy. Sometimes the baby is delivered early. Preeclampsia is a condition that starts after 20 weeks of pregnancy and causes high blood pressure and problems with the kidneys and other organs. The only cure is delivery, which may be done if the baby is close to term. If it is too early, the mother and baby will be monitored closely. Gestational diabetes is diabetes that begins during pregnancy. Usually there are no symptoms, but it is commonly tested for during prenatal tests. If uncontrolled, gestational diabetes can cause preeclampsia, early delivery, problems in the baby once he or she is born, and many other complications. Gestational hypertension is high blood pressure that begins after 20 weeks of pregnancy and goes away after birth. The mother and baby must be closely monitored during pregnancy. High blood pressure is also a sign of preeclampsia. Hyperemesis gravidarum, or HG, is severe nausea and vomiting during pregnancy. It can cause weight loss, faintness, and dehydration. Women with HG may need to be hospitalized so they can be given fluids and nutrients through a tube in their veins. Usually, women with HG begin to feel better by the 20th week of pregnancy. Miscarriage is pregnancy loss from natural causes before 20 weeks. Signs of a miscarriage can include vaginal spotting or bleeding, cramping or abdominal pain, and fluid or tissue passing from the vagina. Contact your healthcare provider right away if you have these symptoms. Problems with the placenta can also cause complications, such as vaginal bleeding, and often require bed rest. Placenta abruption happens when the placenta separates from the uterus too early, limiting the baby's oxygen. Placenta previa happens when the placenta covers the cervix and blocks the birth canal. If this happens, the baby must be delivered by C-section. Preterm labor is going into labor before 37 weeks of pregnancy. Sometimes a woman must deliver the baby early, which is called premature birth. However, medicines are available to try and stop labor if needed. Often bed rest is also needed. Your healthcare provider will decide what is best for you and your baby. Rh incompatibility is a condition that happens during pregnancy if a woman has Rh negative blood and her baby has Rh positive blood. The mother's blood gets sensitized against the Rh factor and may cause the mother's body to attack the baby's red blood cells and limit the baby's oxygen. With proper prenatal care, complications from Rh incompatibility can be prevented. These are just some of the complications that can arise during pregnancy. Talk to your healthcare provider about complications that you may be at risk for. He or she can also help you reduce these risks and monitor your pregnancy more closely. Infections during pregnancy. During pregnancy, some infections can be harmful to you, your baby, or both. Lifestyle habits such as hand washing, practicing safe sex, and avoiding certain foods can help protect you from some infections. This section explains some common infections that can cause complications during pregnancy. Bacterial vaginosis, or BV, is a vaginal infection that is caused by an overgrowth of bacteria normally found in the vagina. BV has been linked to preterm birth and low birth weight babies. Antibiotics are needed to treat the infection. Cytomegalovirus is a common virus that can cause disease in infants whose mothers are infected with CMV during pregnancy. CMV infections in infants can lead to hearing loss, vision loss, and other disabilities. There is currently no treatment safe for pregnant women. Group B strep, or GBS, is a type of bacteria often found in the vagina and rectum of healthy women. GBS usually is not harmful to you, but can be deadly to your baby if passed during childbirth. An antibiotic given during labor will protect your baby if you have GBS. Hepatitis B virus is a viral infection that can be passed to a baby during birth. Newborns that get infected have a 90% chance of developing a lifelong infection. This can lead to liver damage and liver cancer. A vaccine can keep newborns from getting HBV. Influenza, or flu, is a common viral infection that is more likely to cause severe illness in pregnant women. Pregnant women with flu also have a greater chance for serious problems for their unborn baby, including premature labor and delivery. Getting a flu vaccine can prevent complications. People who are pregnant or recently pregnant are more likely to get severely ill with COVID-19 compared with people who are not pregnant. Getting a COVID-19 vaccine can help protect you from severe illness from COVID-19. COVID-19 vaccination is recommended for people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Listeriosis is an infection with the harmful bacteria called Listeria. It is found in some refrigerated and ready-to-eat foods. Infection can cause early delivery or miscarriage. Antibiotics can treat this infection. Most pregnant women who are infected with parvovirus B19 do not have serious problems, but there is a small chance the virus can infect the fetus. This raises the risk of miscarriage during the first 20 weeks of pregnancy. Sexually transmitted diseases are infections passed through sexual contact. Many STDs can be passed to the baby in the womb or during birth. Some effects include stillbirth, low birth weight, and life-threatening infections. STDs also can cause preterm labor. Toxoplasmosis is an infection caused by a parasite found in cat feces, soil, and raw or undercooked meat. If passed to an unborn baby, the infection can cause hearing loss, blindness, or intellectual disabilities. During pregnancy, antibiotics are needed to treat a urinary tract infection or UTI. UTIs are common bacterial infections of the urinary tract. These infections can spread to the kidneys if left untreated. If this happens, preterm labor may start. A yeast infection is caused by an overgrowth of fungi normally found in the vagina. Yeast infections are more common during pregnancy than in other times of a woman's life. They do not threaten the health of your baby, but they can be uncomfortable and difficult to treat in pregnancy. Risk factors. Some women are more likely to experience health problems in pregnancy than other women. These women have risk factors that put them at an increased risk of developing problems. Risk factors for health problems in pregnancy include being pregnant with more than one baby, under age 16, over age 35, underweight, overweight. Other risk factors for health problems in pregnancy are having a history of problems in pregnancy, having cervix or uterus abnormalities, taking certain medications. Use of alcohol, cocaine, and cigarettes also can cause low birth weight, birth defects, and miscarriage. These drugs also have the following risks. Alcohol increases the risk of fetal alcohol syndrome and mental disability. Cocaine increases the risk of placental abruption, premature birth, and stillbirth. Smoking cigarettes increases the risk of stillbirth, premature labor, and problems with the placenta, as well as behavioral problems and mental disability in the baby. These are not the only risk factors for health problems in pregnancy. Talk to your healthcare provider about your medical history and your family's medical history. He or she will be able to tell you if you are at an increased risk of complications during pregnancy. When to seek medical advice. When you are pregnant, do not wait to contact your healthcare provider if something is bothering or worrying you. Sometimes physical changes can be signs of a problem. Call your healthcare provider if you experience bleeding or leaking fluid from the vagina, discomfort, pain or burning with urination, dizziness, discomfort, pain or cramping in the lower abdomen, fever or chills. Also contact your healthcare provider if you have problems seeing or blurred vision, severe or long-lasting headaches, sudden or severe swelling in the face, hands, or fingers, thoughts of harming yourself or your baby, vomiting or persistent nausea. You should also contact your healthcare provider if you suspect your baby is moving less than normal after 28 weeks of pregnancy. Talk to your healthcare provider about how much movement is normal. Prenatal care. Pregnancy is an exciting time, but can also be stressful. Knowing that you are doing all you can to stay healthy during pregnancy and give your baby a healthy start in life will help you to have peace of mind. Even if you take steps to prevent problems, every pregnancy has some risks. Prenatal care is important for this reason. It can help your healthcare provider detect problems early and prevent complications. Prenatal care is the care a woman gets before pregnancy and before her baby is born. Getting early and regular prenatal care is important for both the mother and the developing baby. Prenatal care includes health care, education, and counseling about how to handle pregnancy. Prenatal care can help keep you and your baby healthy. Your healthcare provider will schedule you for many checkups over the course of your pregnancy. Don't miss any. They are all important. Healthcare providers can spot health problems early when they see mothers regularly. This allows healthcare providers to treat any problems early. Early treatment can cure many problems and prevent others. Healthcare providers also can talk to pregnant women about steps they can take to give their babies a healthy start to life. Babies of mothers who don't get prenatal care are 3 times more likely to have a low birth weight. They are also 5 times more likely to die than those born to mothers who do get care. Your healthcare provider can also explain what is normal during pregnancy and what is cause for concern. Your body undergoes many changes during pregnancy, and some symptoms, such as discomfort or nausea, are normal. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Every pregnancy has some risks. Health problems in pregnancy can involve the mother's health, the baby's health, or both. The causes can be health problems you already have or health problems you develop during pregnancy. Sometimes it is hard to know what is normal and what is cause for concern. Always contact your healthcare provider if you are worried. Keep in mind that whether a complication is common or rare, there are ways to manage problems that come up during pregnancy. Thank you for using Explain.